Hey everybody, live from Health by Design. We're still here, we're still open. Today I wanted to lead with a quote from BJ Palmer. So I am going to be reading a couple of things to you because I thought it was kind of cool. I've come across a lot of awesome research in the last few weeks, just trying to study for you guys what's the best way to boost your immune system, how to stay ahead of this pandemic, and just encourage you also that you know what to do, like you are doing things to take control of your health. So BJ Palmer was the founder of Chiropractic, and he said that medicine is the study of disease and what causes man to die or get ill. And chiropractic is the study of health and what causes man to live. So we're going to kind of dive into what does that mean, because it's kind of a cool dichotomy. So what that means is medicine really, like, we wait until there's symptoms or there's illness, and then they pour on, some heroics or emergency type procedures to try to get you out of danger. So chiropractic is more of a preventative philosophy. So the good news is if you are already healthy, we can keep you well. Or if there is some kind of compromise in your system, we can try to undo that and encourage the body to go back in a balanced state to heal itself. And that really is the foundation of chiropractic. So in doing some of my research, I found this really cool report from the ICA, which is the International Chiropractic Association, on chiropractic and immunity. And they were saying that with the COVID-19, that the frustrating part, whether it's alternative medicine or traditional medicine, is that there is no approved medication or therapy, whether it's, like I said, traditional or alternative, for this. And it's basically because there's no research for it yet, because it's a new strand, a new virus kind of a thing. And then the other frustrating part is that it's a virus. So traditional medicine doesn't really have anything for viruses, and they never did. And you guys already know that when you go to the doctor, if you're not feeling well, they'll test you for a bacteria, and if it's positive, they'll give an antibiotic. However, if they find that there is no bacteria present and it's just viral, they send you home and tell you to rest, because only time will heal a virus. So COVID-19 is a virus, so it's like frustrating for traditional medicine. It's not for alternative medicine because of that preventative model, and that the body's holistic and that it can heal itself if we give it what it needs. So the only way we can extrapolate this current pandemic, COVID-19, is to go back to the flu in it was either 1917 to 1918. There was a pandemic of influenza, and it was more commonly known as the Spanish flu. And what's really cool about going back to that was that back then there wasn't a lot of antibiotics, there wasn't antivirals, medicine was pretty basic at that point. But chiropractors did have a much larger role in the whole healthcare paradigm. And they compared the results of traditional medicine with treating people with the Spanish flu compared to the results of people who were under chiropractic care. And the people who were under chiropractic care had less deaths. They had better overall outcomes. And so they said, while disease and pestilence, especially the epidemics, are little understood even back then, and many of the factors that had spread the disease in the 1917 and 1918 were mysterious, they didn't know anything about prevention, protection, treatment, or the cure of influenza. So the whole world stood at its mercy, or lack of it. And so when they introduced chiropractors were getting fantastic results, and the statistics spoke for themselves. So I'm going to flip over here. We've got a cool graph. Chiropractic was founded in Davenport, Iowa. So what they did is they studied people who were under the care of traditional medical doctors, and they studied almost 5,000 people. And of the 5,000 people under traditional medical care for the Spanish flu, there were 274 deaths. So I did the math for you because we're not math people. That's 6% of people in Davenport, Iowa. Then they went and looked at the number of people who were under chiropractic care, and they studied 1,600. So I realized it was less total people. So I'm not bending statistics here. I know how that can be done. not interested in trying to over dramatize the numbers, there was only one death. And so if you do the math on that, that was 0.0006%. So we have 6% under traditional medicine, 0.0006% under alternative medicine or chiropractic. That was the only alternative medicine. Then they went and studied the state of Iowa at large. So they panned out from Davenport to the whole entire state of Iowa. And then they compared the state of Oklahoma. And you got similar numbers. And what was interesting was that in Oklahoma, after the medical doctors had given up on 233 patients, so they basically said there was nothing more that they could do. These people were just at the mercy of the flu and they were expected to die. They actually called the chiropractors in to see if there was anything additional that could be done, and they allowed them to do adjustments on those 233 otherwise lost patients. And when the chiropractors were called in, there were 208 survivors out of the 233 and only 25 deaths. So we're not saying that this is the Spanish flu, but that proves that the only difference in any of those cases was the difference between just traditional medicine and the addition of chiropractic care. And there's study upon studies of how, chiropractic helps with all these neuromodulators and cytokines and substance P and white blood cell count and lymphocytes and killer cells and helper cells, which is all part of the immune system. We have studies. And what I think is interesting for people to know is that this isn't chiropractic research. This research, these numbers, comes from traditional medicine. So they've done the research for us to prove that chiropractic can be an integral part in just the overall healthcare paradigm and in the preventative model. So what it says in conclusion, and this is still from the ICA report on chiropractic and your immune system, is that chiropractic is a healthcare discipline which emphasizes the inherent recuperative power of the body to heal itself without the use of drugs or surgery. The practice of chiropractic focuses on the relationship between structure, primarily the spine, and function as coordinated by the nervous system. So your nervous system controls every other organ and cell in your body. Your nervous system is the master controller, the master brain of everything. And chiropractic is how that relationship affects the preservation and restoration of health. It is founded upon the principle that the body's innate recuperative power is affected by and integrated through the nervous system. So that's it in a nutshell. If you were ever wondering how in the world is chiropractic helping the immune system, what's the relationship, there you have it, right from our own International Chiropractic Association, talking about the numbers from the pandemic of the Spanish flu in the 1917 and 1918 time era, and just in the hopes that people will find some empowerment and some tools that can actually help, and that there's some research behind. There's a lot of people out there that are selling wellness and holistic and supplements. I mean, you can go to Amazon and you can go to your box stores, and like anything that helps with disinfectants and is antiviral or immune supportive has literally been sold off of the shelves. And just cautioning people, make sure you're getting something that's got some backbone to it. Haha, chiropractic joke, but really that can stand on its own 2 feet with some research and some benefit. So we're going to try to come live to you throughout the week. We've got some exciting topics. I encourage you to stay tuned. If you haven't got an adjustment, come on in, get your appointments. Let's get you and your family adjusted. Kids respond amazing to chiropractic. It's like just turning little light switches on because they don't have all the years of additional stress and exposures that us adults do. I'm just looking at the upcoming schedule. So we're going to be talking this week about how fear lowers your overall tone level and how that can leave you susceptible, to immune issues. And we're also going to talk about if you do have symptoms of respiratory distress, what you can do. So please stay tuned. We're here for you all week. Our office is open. We can ship supplements. We can deliver them curbside. If you aren't comfortable coming in, even though we are following all the CDC guidelines to keep you safe, we can definitely do phone consults and virtual appointments as well. So we're here for you. And like I keep saying, stay safe and stay sane. Bye.